Welcome to another video of Clinical Biochemistry Unit 5, second video. Let's start. 1. Phosphorus, molybdate UV method. Principle. Inorganic phosphate reacts with ammonium molybdate in an acidic medium to form a phosphomolybdate complex, which absorbs UV light and is measured spectrophotometrically. Procedure. 1. Mix serum with ammonium molybdate reagent. 2. Incubate for 10 minutes at 37 degrees Celsius. 3. Measure absorbance at 340 nm. Precautions. Avoid hemolysis, RBCs contain phosphate. Maintain pH for proper color development. Calibration of graph. Use phosphate standards, e.g., 4 mg/dl. Plot absorbance versus concentration. Normal values. 2.5 to 4.5 mg/dl. 2. Sodium, flame photometry method. Principle. Sodium emits a characteristic yellow flame when excited in a flame photometer. The intensity of the emitted light is proportional to sodium concentration. Procedure. 1. Dilute serum with deionized water. 2. Aspirate into flame photometer. 3. Measure emission at 589 nm. Precautions. Use fresh samples to avoid evaporation. Avoid contamination with sodium-containing reagents. Calibration of graph. Use sodium standards, e.g., 140 mol/L. Plot intensity versus concentration. Normal values. 135 to 145 mol/L. 3. Potassium, flame photometry method. Principle. Potassium emits violet light when introduced into a flame photometer, and its intensity is measured. Procedure. 1. Dilute serum with deionized water. 2. Aspirate into flame photometer. 3. Measure emission at 766 nm. Precautions. Avoid hemolysis, RBCs contain potassium. Use fresh samples to prevent potassium leakage. Calibration of graph. Use potassium standards, e.g., 4 mol/L. Plot intensity versus concentration. Normal values. 3.5 to 5.0 mol/L. 4. Chloride, colorimetric or coulometric method. Principle. Chloride ions react with mercuric thiocyanate to form a red complex, measured colorimetrically. Procedure. 1. Mix serum with reagent. 2. Incubate at room temperature. 3. Measure absorbance at 480 nm. Precautions. Avoid contamination with sweat or saline. Use fresh reagents. Calibration of graph. Use chloride standards, e.g., 100 mol/L. Plot absorbance versus concentration. Normal values. 98 to 107 mol/L. 5. Creatinine, Jaffe's method. Principle. Creatinine reacts with picric acid in alkaline medium to form a red-orange complex measured spectrophotometrically. Procedure. 1. Mix serum with alkaline picrate reagent. 2. Incubate for 2 minutes at 25 degrees Celsius. 3. Measure absorbance at 520 nm. Precautions. Avoid hemolysis. Correct for nonspecific protein reaction. Calibration of graph. Use creatinine standards, e.g., 1 mg/dl. Plot absorbance versus concentration. Normal values. 0.6 to 1.3 mg/dl. 6. Cholesterol, enzymatic CHOD-PAP method. Principle. Cholesterol is oxidized by cholesterol oxidase, CHOD, to form hydrogen peroxide, which reacts with phenol and 4-AAP to produce a red color. Procedure. 1. Mix serum with reagent. 2. Incubate for 10 minutes at 37 degrees Celsius. 3. Measure absorbance at 500 nm. Precautions. Avoid lipemic serum. Use fresh reagents. Calibration of graph. Use cholesterol standards, e.g., 200 mg/dl. Plot absorbance versus concentration. Normal values. 200 mg/dl. 7 triglycerides, GPO-PAP method. Principle. Triglycerides are hydrolyzed to glycerol, which reacts with glycerol phosphate oxidase, GPO, to form a colored complex. Procedure. 1. Mix serum with reagent. 2. Incubate for 10 minutes at 37 degrees Celsius. 3. Measure absorbance at 505 nm. Precautions. Avoid alcohol intake before testing. Use fasting samples. Calibration of graph. Use triglyceride standards, e.g., 150 mg/dl. Plot absorbance versus concentration. Normal values. 150 mg/dl. 8 HDL and LDL, precipitation method. Principle. HDL is separated by precipitating LDL and VLDL, then cholesterol is estimated using CHOD-PAP method. Procedure. 1. Precipitate LDL and VLDL using a reagent. 2. Centrifuge and measure HDL in supernatant. 3. Use Friedewald formula to estimate LDL. Precautions. Use fasting samples. Avoid hemolysis. Calibration of graph. Use HDL and LDL standards. Plot absorbance versus concentration. Normal values. HDL, greater than 40 mg/dl, men, greater than 50 mg/dl, women. LDL, 100 mg/dl. 9. Uric acid, uricase method. Principle. Uric acid is oxidized by uricase to allantoin, producing hydrogen peroxide, which reacts with 4-AAP. Procedure. 1. Mix serum with reagent. 2. Incubate for 10 minutes at 37 degrees Celsius. 3. Measure absorbance at 520 nm. Precautions. Avoid high vitamin C intake before testing. Calibration of graph. Use uric acid standards, e.g., 6 mg/dl. Plot absorbance versus concentration. Normal values. 3.5 to 7.2 mg/dl. 10. Protein, Biuret method. Principle. Proteins react with copper sulfate in alkaline medium to form a purple complex. Procedure. 1. Mix serum with Biuret reagent. 2. Incubate for 10 minutes at room temperature. 3. Measure absorbance at 540 nm. Precautions. Avoid hemolysis. Calibration of graph. Use protein standards, e.g., 7g/dl. Plot absorbance versus concentration. Normal values. 6.0 to 8.3 g/dl. 11. Bilirubin, diazo method. Principle. Bilirubin reacts with diazotized sulfonilic acid to form a colored complex. Procedure. 1. Mix serum with reagent. 2. Incubate for 5 minutes at room temperature. 3. Measure absorbance at 540 nm. Precautions. Protect from light. Calibration of graph. Use bilirubin standards, e.g., 1 mg/dl. Plot absorbance versus concentration. Normal values. Total, 0.3 to 1.2 mg/dl. Direct, 0.3 mg/dl. Important MCQS. 1. In the phosphorus estimation method, what is the role of ammonium molybdate? A. Acts as a catalyst. B. Forms a phosphomolybdate complex. C. Oxidizes phosphate to pyrophosphate. D. Acts as a pH stabilizer. Answer, B. 2. Which wavelength is used for measuring phosphorus in the molybdate UV method? A. 340 nm. B. 405 nm. C. 500 nm. D. 600 nm. Answer, A. 3. What is the primary limitation of flame photometry in sodium estimation? A. Requires enzymatic activation. B. Interference from calcium ions. C. Needs a stable flame temperature. D. Only measures ionized sodium. Answer: C. 4. Which factor does not interfere with potassium estimation by flame photometry? A. Hemolysis. B. Lithium contamination. C. Turbidity in the sample. D. Oxygen concentration in the flame. Answer: D. 5. The chloride estimation method using mercuric thiocyanate is based on which principle? A. Precipitation reaction. B. Complex formation with iron. C. pH-dependent color change. D. Redox reaction. Answer: B. 6. Creatinine reacts with which reagent in the JAF method? A. Uricase. B. Picric acid. C. Orthotoluidine. D. Biuret reagent. Answer: B. 7. What is the primary limitation of the JAF reaction for creatinine estimation? A. Requires enzyme catalysis. B. Produces an unstable colored complex. C. Interference from proteins and ketones. D. Requires a fluorescence detector. Answer: C. 8. In cholesterol estimation using the CHODPAP method, which enzyme converts cholesterol esters to free cholesterol? A. Cholesterol oxidase. B. Cholesterol esterase. C. Peroxidase. D. Phosphatase. Answer: B. 9. Which of the following is not required in the triglyceride GPO-PAP method? A. Glycerol kinase. B. Lipase. C. Peroxidase. D. Urease. Answer: D. 10. The Friedewald equation is used to estimate which lipid parameter? A. Triglycerides. B. Total cholesterol. C. LDL cholesterol. D. HDL cholesterol. Answer: C. 11. In HDL estimation, how are LDL and VLDL removed from the sample? A. Dialysis. B. Enzymatic hydrolysis. C. Precipitation with a reagent. D. Adsorption onto silica. Answer: C. 12. In the uric acid estimation method, uricase converts uric acid into which of the following? A. Urea. B. Allantoin. C. Creatinine. D. Xanthine. Answer: B. 13. Which of the following substances can interfere with uric acid estimation? A. Glucose. B. Ascorbic acid. C. Calcium ions. D. Ammonia. Answer: B. 14. In the Biuret method for protein estimation, which metal ion is essential for color development? A. Zinc. B. Copper. C. Iron. D. Magnesium. Answer: B. 15. Why is bilirubin estimation performed under low light conditions? A. Light exposure increases bilirubin binding. B. Light causes oxidation of bilirubin. C. Light degrades the diazo reagent. D. Bilirubin forms aggregates in the dark. Answer: B. 16. Which fraction of bilirubin reacts directly with the diazo reagent? A. Conjugated bilirubin. B. Unconjugated bilirubin. C. Biliverdin. D. Free hemoglobin. Answer: A. 17. The normal range of total protein in serum is approximately A. 4.0 to 6.0 g/dl. B. 6.0 to 8.3 g/dl. C. 8.5 to 10.5 g/dl. D. 10 to 12 g/dl. Answer: B. 18. Which of the following enzymes is not used in lipid profile analysis? A. Lipase. B. Cholesterol oxidase. C. Urease. D. Glycerol kinase. Answer: C. 19. In the Biuret reaction, the intensity of the color complex is proportional to A. The number of peptide bonds. B. The molecular weight of the protein. C. The temperature of the reaction. D. The pH of the solution. Answer: A. 20. The method used for bilirubin estimation involving van den Berg reaction is known as A. Jaffe method. B. Berthelot reaction. C. Diazo method. D. Orthodoluidine method. Answer: C. Answer key. Thanks you for watching.